Hi, I'm Liz. Today I will show you the proper technique for using an insulin pen. An insulin pen looks like a pen. A few examples of insulin that comes in pens are Lantus, Novolog, and Humalog. The insulin pen has a cap, a rubber stopper, a cartridge scale, a cartridge, a dose indicator window, a pointer, a dose selector, and a button. To prepare for the injection, you will need the insulin pen, the needle, and an alcohol swab. Always use a new needle with every injection. Do not reuse or share needles. Next, make sure you have the correct insulin. Check the name of the insulin, the expiration date and beyond use date, and your dose. To give your insulin injection, first choose your injection site. Insulin must be injected into fatty tissue under the surface of the skin, not into muscle. You can inject either in the abdomen, the thigh, or the back of the arm. The preferred injection site is the abdomen. It is preferred because insulin is absorbed more quickly and predictably there. And this part of your body is also easy to reach. Some people prefer to use the back of the arm. If you inject in the arm, use the fatty area on the back of your arm between your shoulder and your elbow. Take care not to inject in the same place 2 times in a row. Each site should be separated by the width of your pointer finger. If you are unsure where you injected last, ask the healthcare staff. Today, I will demonstrate a subcutaneous injection in the abdomen. In order to rotate sites when injecting into your abdomen, divide the area between your hips into 4 sections. Work your way in a circle from one hip to the other, staying 2 inches away from your belly button. Healthcare staff will prime your pen to ensure it is working properly and dial your dose. If your dose is over 80 units, you should do 2 injections. Cleanse the site with the alcohol swab and let the area dry. Inject the insulin by going straight into the skin at a 90-degree angle. Press the button until the dose selector goes to 0. Keep the button pushed in and count to 6 to ensure the entire insulin dose is out of the pen and needle. Release the button and remove the insulin needle by pulling straight out. If blood appears, after administration, press the area with an alcohol swab. Engage the safety mechanism, twist to remove the needle, and place it into a sharps container. Hand the pen back to the healthcare staff.